What is AFib and how does it cause stroke? Imagine your heart as a well-coordinated pump that keeps blood flowing smoothly through your body. In atrial fibrillation, or AFib, that rhythm gets disrupted. Instead of a steady, organized beat, the upper chambers of your heart, called the atria, beat irregularly and often very fast. This chaotic electrical activity causes the atria to quiver rather than contract properly. As a result, blood can start to pool in parts of the heart, especially in a small pouch called the left atrial appendage. When blood pools, it increases the chance of forming tiny clots or thrombi. These clots can break loose and travel through the bloodstream to the brain. When they block blood flow in the brain's arteries, it causes an ischemic stroke, which is the most common type of stroke linked to AFib. The connection between AFib and stroke is well established through decades of clinical research. Because the atria do not contract effectively during AFib, blood stagnates and promotes clot formation. These clots can then embolize or travel to the brain and block vital blood flow. Strokes caused by AFib tend to be more severe, often resulting in greater disability or even death. That's why managing AFib is so important for stroke prevention. Other factors also influence the risk of stroke in people with AFib. Conditions like high blood pressure, diabetes, heart failure, or a history of previous stroke increase the likelihood of clot formation. Doctors often use risk assessment tools such as the CHOTA-DS2-VASC score to evaluate an individual's stroke risk. This score considers factors like age, gender, and other health conditions to help decide if blood-thinning medications are needed. Treatment strategies mainly focus on preventing clot formation. Anticoagulant medications, such as warfarin or newer direct oral anticoagulants, are prescribed to reduce the risk of stroke. These medicines work by thinning the blood, making it less likely for clots to form. Even with anticoagulation, some patients may still have residual risk, which highlights the importance of personalized care and ongoing monitoring. In summary, AFib causes stroke mainly by creating an environment in the heart that favors blood clot formation. These clots can then travel to the brain and cause an ischemic stroke. Recognizing the risk factors and using appropriate preventive treatments can significantly reduce the chance of a stroke. If you or someone you know has AFib, it's essential to work with healthcare professionals to develop a tailored plan for stroke prevention. Always seek personalized medical advice to understand your specific risk and treatment options.